Good afternoon, it's Mayor Turner. I just wanted to update you on the numbers so far. We just got off the medical center press conference, and I really want to encourage everyone to go watch the medical center press conference. A lot of people have sent questions to me and questions to nearly everyone asking about Dr. Bartlett's recommendation. The recommendation Dr. Bartlett is making is on a steroid inhaler. I know a little bit about those because I've been asthmatic all my life. And so all those questions are answered on the medical center press conference. They talk about it. And basically just to give you the update in a nutshell, one thing the doctor said is when you use an inhaler, I use an inhaler on a daily basis, you get the medicine in your lungs, but it's not as efficient as putting it into your veins. Say you want to, say you're in the hospital, they've given you an IV, they can give you steroids in your veins that cover the entire body, whereas the inhaler is basically just going into your lungs. And so they explain that, talk about they've tried it on some patients and it really had no effect, but please go watch that. Post it on Medical Center's website. I will also put it on my Facebook so that you can watch it. There is a double part. For some reason, when we get that many people on a press conference, it actually drops, usually mid press conference. So I will post both of those. So that way you can watch it, understand it. I felt a lot better after I watched it because I could understand what they're talking about. Let's talk about numbers. Right now, Amarillo is at 4,093. Lubbock is at 3,748. Abilene is at 1,311. San Angelo has gone up, so they're now at 713. Currently, according to the website, Midland is at 1,104. And as of right now, we are at 1,964 cases. We have 1,129 cases active. What that means is that's the total number that have COVID minus the ones that have recovered, which we have 816 recovered. We have had 19 deaths. Unfortunately, there were 5 deaths this weekend. 4 were at Medical Center, 1 was at ORMC. I will go ahead and give you the numbers for Medical Center. Currently, they have 47 patients in Medical Center right now. They have 5 on ventilators at Medical Center itself, and in their overflow, which is the Stuart Wheatley building, they have 5 people on ventilators there. They are issuing a plea for retirees that are nurses, respiratory therapists, the phlebotomists, which are the people that take blood. They're putting that out to the retirees and to anyone who has those skills. They need more help because of the numbers they have out with COVID. They can't come back for 2 weeks. So that's what they're asking for. So if you're anybody that wants to find a job that's a nurse or a phlebotomist or a respiratory therapist, they're looking at signing short-term contracts, maybe up to 12 weeks, but Medical Center can help you with that kind of information. Over at ORMC, they have 16 cases, and they have 10 that are on respirators. So that gives you an idea. They have 25 that they're waiting, 25 pending tests, which we are waiting for answers for. But the pending number has gone down. A lot of that is because the lab has shut down and we are using a different lab. So that has helped to catch those numbers up, and hopefully fairly quickly CPL will be coming back online and allowing people to send them tests. Give you a little bit, Focus Care in Odessa has 2 active cases that are in, I believe, Medical Center. Siena has 11 cases. the nursing home there. They have received each hospital has received people from outlying areas. They have 2 from Pecos County, 3 from Andrews County, 1 from Rio Grande County, and 1 from Reeves County. So those are people that were sick in the outlying areas and have been brought in. The Courtyard in Odessa also has 2 cases. So ORMC is 16 staff members that are out because of COVID, either in the process of being diagnosed or having symptoms, and they're just quarantined right now. So listen to, on the press conference, Dr. Dar, who is the physician who has taken care of the most COVID patients at ORMC, spoke. And he really was wanting to talk about the seriousness of this illness and really the lack of predictability for treating this illness. And it's a very good conversation he has. And he talked about how much he admires the nurses and the amazing job that they're doing. He said they had 6 hours in organized chaos in the ICU of ORMC. And he talked really about how above and beyond all of the nurses went to help save patients there. So if you would, that's all I've got today. The numbers are going up, but they're not going up as quickly, which is fantastic. The doctors contribute most of that to mask wearing, but we are still in that stage when we are waiting for the July 4th weekends to see people that could become positive, because we saw some after Memorial Day. So we are still expecting some to go up because of the July 4th weekend. We're looking for those in about 7 to 10 days. So that's what we're really watching. We've talked about, in city government, we talk about the Pick 6 cities. Why do we do this? Well, it's the 6 cities that are closest to us and relatively close in size. Those cities are Midland, Odessa, Abilene, San Angelo, Lubbock, and Amarillo. With the Pick 6 cities, right now we are ranked 3rd from the top in highest numbers of COVID. So this is something we need to continue to take seriously. Please wear a mask. I understand there's people out there that aren't going to wear a mask. Don't be one of those. Wear a mask, even if it's not even if you don't believe it's going to protect you, please do. It's helping to hold some of these numbers down. We are starting to see the results of that. So please watch the press conference. It's full of great information. Even Scott with CBS 7 was asking about some of the Dr. Bartlett stuff and things like that. Both hospitals address it. Medical Center has used it. ORMC talks about it also. Medical Center used it on a patient that requested it. It's really between the doctor and the patient. A lot of people email me, say, why aren't we trying this? I can't make the doctors use it. It's just, you wouldn't want me telling your doctor what to give you. But we have passed all the information along. So their whole point with it was, it's better for us to give them the medicine through an IV. They can get all around the body versus an inhaler. So please watch that. God bless each and every one of you. God bless Odessa. God bless Texas. And God bless the USA. And keep up the good work. We're starting to see the numbers come down. But I will be with you on Wednesday and catch you up then. God bless each and every one of you. Thank you.